This is the story of your community and its health data. Looking after a community means getting to know the people who live in it and what services they need. To make good decisions, you need to understand their health journey across their life stages and where they could be headed. You also need mountains of data. If this data isn't collected and made available in the same way everywhere, things get messy. Enter Sparked, Australia's fire accelerator. To make the right decisions at all levels requires the sharing of good quality and de-identified data because protecting people's privacy matters. Standardisation means that accurate data collection from point of care can drive innovation throughout the whole health sector. It also builds the foundation for a learning health system where data is continuously and securely analysed to improve health outcomes for everyone. Now, what Bright Spark thought of that? Sparked. Better standards, better health, better outcomes.
G'day. Welcome back to the Sparked Symposium. After the morning break, we've still got strong attendance here. Thank you for participating in the Menti poll over the short break period. We can see the results of that here. And for those who may have just joined us too, we'll give you a quick opportunity to pop in an answer on where you're from and where you're joining us here today. Seeing great representation across Australia and around the world as well. We've got a packed agenda, and we kicked off with really looking at what's happening across the world. We can see that continuing to evolve here. I won't be able to give you too much time to update these, but you can just click in through, let us know what type of organisation you're joining from. Got great representation across the ecosystem here, and we've heard from some of those representatives already, and will later in the agenda as well. And what's cool is that we've got everyone from the OGs, the original participants who have been here since 2023 and Sparked, and then a lot of people who this is their first experience. So throughout the session, you'll see video clips and you'll hear from things. And I think it's an event in itself, seeing what's happening through the chat and the discussion that's happening. Some of it's relevant, some of it's not. There's discussion about puppies. Sparkle the puppy is quite popular there in the chat, so do keep the conversation going in there during the sessions as well. But we're going to continue to jump in through the agenda. So let's get stuck in. You'll see on your agenda that session 2 today is split into 2 parts, and right now we're going to focus on Australia on Fire, and we'll have representatives from the Sparked partners who will be sharing with you some slides and some reflections, and then in a similar format that we did in the first part, we will then do a bit of a panel discussion in the to kind of round out. So do keep those comments and questions coming through on the chat, because that'll definitely inform where we take that conversation. So in this first one, I'm going to welcome to the stage Simon Cleverly, who will be popping up next to me in just a moment. G'day, Simon. It's great to see you here. Look, I'm going to bring your slides up and let you take it away. So thank you so much for joining, and we'll remove the Menti and bring up the Simon slides, and over to you.
Thanks, Peter. Great to see everybody. Nice to be here today for the Spark Symposium. For those who I haven't met before, I'm Simon Cleverly. I'm the Assistant Secretary of the Digital Health Branch at the Australian Government Department of Health, Disability and Ageing. I'm here really to share some insights with you about the important role Spark is playing to enable the Australian Government to play its part in delivering a more person-centred, connected, sustainable health system for all Australians. And really the phrase you can see on your screen there about person-centeredness, about connections, about sustainability really comes from our Australian Government Digital Health Blueprint, which is the Australian Government's 10-year vision for the role that digital health tools and capabilities and services are really going to play in realising this objective. Next slide, please, Peter. To really express the importance of Sparked to realising this objective, I just wanted to share some deeper insights about the Australian government's ambitions for modernising our health system. You can see from the slide here, it's a little bit busy. Don't worry about all the words. I'm sure you'll get the slides in your pack at the end of this session. But the infographic on the right-hand side is taken from the blueprint. And you can kind of see at the very heart is the concept of a learning health system. I thought the grab at the start of this session was perfect because it sort of introduced that concept of what a learning health system is, so I don't have to teach everybody about what we mean. But having said that, really what we mean about that is how do we use knowledge to ensure Australians have a choice in determining their own health and wellbeing journey? How do we make sure that healthcare providers can access the information they need at the point of care to be able to provide the best treatments to their patients? How do we use the data created at the point of care to make sure that it can be reused safely, securely by researchers, innovators, and public health planners? And we really want to make sure that we can do this so that we can create that concept of a learning health system to inform the development of new treatments, new therapies. We want to make sure that every dollar that we spend on health delivers high value outcomes for Australians. So when we talk about a learning health system, that's what we mean. But of course, none of this can really truly be realised at the national scale without having the right foundations in place. And that includes the right policies, the right legislation and regulations. Peter, I noted your little menti there about regulating standards, the right safeguards, the right health and digital health literacy programs, and of course, the right standards to ensure our health system can be truly interoperable. Next slide, please. Despite what you might all think about how challenging this might sound when we've got 1.1 million Australians. I'm not sure what's happened with the slide there, Peter. Is there another click on that one? We should have a little Australia in the middle. If not, it doesn't really matter. No. Okay, we'll push on. 1.1 million healthcare providers delivering care in Australia. We've got nearly 27 million Australians. You know, that's a huge number of circumstances that we have to cater for. I heard Daniel present earlier about where Australia is from the perspective of the Commonwealth Fund, having ranked Australia's health system as the top performing country in 2024. You know, we've got some really world-leading things in place. We've got world-leading legislation in things like our National Healthcare Identifiers Act that provides a framework for uniquely connecting Australians with their health information. In February this year, many people will be familiar in Australia that we had the Australian Parliament pass new legislation to transition our national consumer-controlled My Health record system from a share-by-exception system to a system that will require healthcare providers to share health information to a consumer's My Health record by default, commencing with pathology and radiology reports. I'm sure Peter will talk more about the National Interoperability Plan shortly, but you know, we've already got 40% of the actions in that plan having now been delivered inside of 2 years since that plan was released. And of course, we've also got now the world's most active fire accelerator program. You know, we've gone from, in the space of 18 months, our Sparked community having launched to the world's most active, more than 21,000 hours of time contributed from members in just a little over 18 months, which is a remarkable achievement. And while we may have started our journey a little later than some countries, the Australian story really hasn't come about by chance. Together, we've all put in place, I think, the right stewardship model. We've brought the best and brightest experts together, and we've created a shared ambition, an ambition to establish a learning health system to benefit all Australians to live healthy, active life. What's on your page there, it hasn't quite come up. There is supposed to be a little map of Australia in the middle, sort of demonstrating that we're sort of somewhere in the middle of that group at the top left and the bottom right. And this is taken from the Healthcare Interoperability 2025 country rankings, which was released by Black Book Research in April this year. And you'll see with Australia sitting in the middle there, if you've read that research, you'll see Australia finished 9th out of the 18 high income countries that were surveyed. And I think the report highlights that we do continue to advance, but we continue to face issues as it relates to integration between different parts of our health system. It also cites uneven digital maturity and variable system engagement across regions as key challenges to achieving full connectivity. But it also highlights that countries that have achieved the highest levels of interoperability have done so through strong national strategies that prioritise data standards, patient-centred reforms, and public-private collaboration. And I think, really we're sort of trying to set all the foundations for that across the agenda that we're pursuing. Next slide, please. This one has a little QR thing at the top right, which just takes you to the digital health blueprint. And again, you'll get these slides afterwards, so don't feel like you have to run to your phone to try and make that happen quickly now. But really, this slide is just meant to demonstrate a snapshot of the significant efforts that are underway that we're stewarding at the national level to fast track that digital maturity that I just touched on. And as many of you will understand, achieving a connected, interoperable health system, it's not just about technology, it's about people. And I think the Sparked initiative is really a manifestation of this. And it represents how we bring technology together with the people that need to use it to ensure that we can improve the health and well-being of Australians. I think that's a really important concept. For anyone who was at the Victorian Healthcare Week in November last year, the Federal Minister for Health said, and it's remarkable in its own right that the minister's up on stage talking about Sparked via Accelerator. He said, "The strength of Spark lies in its bottom-up process of community consultation and consensus." And I think he's right. And really what we've tried to do within my team and the work that we're delivering that you can kind of see on your screen there is we've really tried to work very hard to embed this concept across the whole program. Whether this is the deep community consultation engagement that's gone into informing the legislative reforms that I've touched on, whether it's the partnership approach that we've put in place by directly engaging with the Medical Software Industry Association and Ageing Australia to inform a policy paper that we're writing at the moment that we hope will be used to underpin national consultation on system-wide cyber uplift, or the arrangements that we've got in place to have consumer advisors directly engaged and embedded within my team to inform the very formative stages of policy development life cycles within the department. We feel that we've got a deep understanding that the connection between technology and people is fundamental if we want to accelerate our funding and system reforms. Next slide, Peter. So I'm going to keep this all pretty short and sweet. So maybe, Peter, we have a bit more time for questions and discussion at the end. But really, I sort of wanted to just leave people with a sense that, when you are down in the middle of something like a Sparked program and you're giving up all of that time to go and really work on some of the foundations that are going to shape the way that we do health information sharing in the future, it's kind of hard to sort of get some perspective about how much work we've done and what the sorts of things are that this is going to support. And so really what I've sort of put up on the screen here is just to give people a sense over the next 12 months of some of the foundations and the critical work that the Spark community is really contributing to start to enable us to bring to life some of the new national capabilities and the new national infrastructure that we're going to be able to better integrate our health system. I talk a lot about the concept of record portability with my team because I think sometimes when if you're new to this, and this is kind of the first time that you've been involved or you've heard about Spark or what it's doing, it is sometimes a bit difficult to kind of really make sense of all of this. But I talk about record portability because I think it makes sense to people that the idea that you could create and store information in one clinical system, but that information is just so important to all the other clinical systems and to the patient right across the health system. We need to make sure that no matter where a patient interacts with the health system, their allergies, their current medicines list, their critical results are available no matter what clinical system the information is stored in. In other words, ensuring health information can follow the patient on their health and well-being journey and for it to be portable, to follow them around the system. For example, work to implement new capabilities for chronic condition management plans and health assessments. That's underway, and that the Spark community is very deeply involved in establishing the foundations for that, so that a patient and all members of the care team, not just the GP, not just the allied health providers, can actually see information about that person's care journey in near real time. Encounter summaries, patient summaries can be accessed in an emergency so that a busy ED doctor can have the health information that they need to provide safe, high quality care in an emergency. And requests and referrals, another good example, can support more seamless movement of patients across our complex federated health system to support new models of care and ensure that we have used the data to provide the right care based on the evidence. Of course, in the time available today, it's a bit superficial to kind of give you this sort of an overview. Some people are way more experienced with this than others. And so I just wanted to give a sense that, all of this information, all of this work, all of this time that people are putting into developing the data standards that can sit under these sorts of capabilities, none of it's possible without Spark and without this community. It's probably worth just finishing by highlighting at this point that the Spark program has received further funding in the 25-26 financial year to complete the work that's for the existing priority initiatives, many of which I've just touched on there. The steering committee, which oversights the Spark community, which is a partnership model. I chair that committee with the Australian Digital Health Agency, with the CSIRO and with HL7 Australia. We're currently working on the future priorities, and we're looking for the Sparked community to start help shaping these over the coming months as we look to establish Sparked as a going concern to not only develop those priority implementation guides, but to also ensure that we've got the right settings and the funding in place to support the maintenance of fire standards in Australia as we move towards a sustainable long-term model for the program. So really, in sort of finishing off, Peter, I'd like just to really take this opportunity to thank the literally thousands of people involved in the Spark program that have already contributed to shaping the future of our ambitions to realise the potential of a learning health system. I'd like to use this as an opportunity for the people here today that you don't have to be an expert in your field if you're thinking of getting involved in this. Come and participate in the community. If you're an informatician, if you're a clinician, if you're a policy or a program manager, if you've just got a deep personal interest, bring your lived experience. We want you involved in these programs. The more people we've got involved, the more opinions that we've got into how this information moves around our system to support all the different use cases, then the stronger and the better we will be together. So on that note, Peter, I'm going to pause there. Look forward to the discussion throughout the rest of today, and I'll hand back to you. Thanks very much.
Yeah, love it. Thank you, Simon. Some great framing as we focus on Australia on fire. I'm going to get you to hang around for a little bit as we bring everyone onto a panel shortly. So thank you so much, Simon. As we continue to hear from the partners of Sparked, I'm going to bring on to the virtual stage from the Australian Digital Health Agency, Peter O'Halloran. Thank you so much for joining us today.
Thanks, Peter, and good morning to everyone. It's lovely to be here as always. Spark's one of those, I suppose, one of the most fun parts of my job, and I look forward to all of these symposiums every time. I must admit I've been hiding in the comments, not answering much, but I've been scribbling notes madly. So thanks, everyone. Keep up the comments. We are reading them and paying attention. Each time we come together, I talk about what the agency is doing to embrace the work from Sparked and Fire and how it's all going. So I thought I'd give you an update on that, what's been happening over the last 3 or 4 months. So you might all recall I've previously talked about how the agencies embrace fire. We're actively engaged in Sparked, and a whole lot of staff from across the agency are involved in different working groups, and some of them are co-chairs. And it really is wonderful seeing the community come together. You might also recall last time I actually demoed some discovery work we've been doing, which lets us dynamically generate an international patient summary from My Health Record data, and work on that is continuing, more as a proof of concept than anything we'll implement, just so that we get the learnings about how we actually can extract data from the system, how we bring it together, and how we could actually look at generating patient summaries on the fly in the future. Also, a quick update. We've delivered in the past, in conjunction with our partners in HL7 Australia, fire training courses. The great news is that these courses have been refreshed. And in fact, the first course of the new refresh ones we delivered next month, which is only 3 days away until we're in June. So if you aren't already on the waiting list and you want to do fire training courses, you can register now on our website. But the thing I really want to emphasize, I suppose, today is, if I put it as simply as I can, Sparked and the work that's being developed through the discussions we're having, through all the collaboration and the community development process, is at the core of everything we are doing to fire up My Health Record. Behind the scenes, our team are now starting to work on updating the specifications to move from those CDA format documents, the so-called shoebox of PDFs, as the Minister Butler refers to them, moving to atomic data elements. And that really is such a critical transformation of My Health Record. We're moving from the pre-formatted sort of structured document to individual elements that can be shared, whether that might be 3 or 4 elements from a consultation with a GP, or an allied health professional might have 6 or 8 elements. There might be something from a home-based medical device from the patient being brought together, and then it might be a full discharge summary from a hospital admission. Moving to atomic data elements and using FHIR, standardized terminology such as SNOMED CT and the ref sets, and all that being brought together through the outputs from Sparked, really will transform how healthcare information can be shared in Australia. And we're doing our part on that. Next year, and we're only 7 months until this year is finished, which is suitably depressing, we'll be publishing draft My Health Record specifications, replacing the existing clinical document specifications, and conformance requirements for comment. We'll be seeking views from across the sector, whether it's from healthcare consumers, clinicians, informaticians, technologists, on all those draft specifications. When they come out, you'll see that the Sparked outputs are baked into those specifications and conformance requirements. And our conformance process is, for those of you who haven't been involved with it, how we actually do the validation to ensure that software is safe and appropriate to connect to national infrastructure such as My Health Record. And that looks at everything from cybersecurity to the legal basis, right the way through to things such as, is the data actually being displayed in the same way that it was received, so that there's no clinical risks in that respect. We're currently working with timelines to look at when will we cease doing conformance requests using CDA. We're still working on this and we'll be consulting, but I would imagine within 2 years, we'll probably stop accepting any new conformance requests using CDA. All the conformance requirements then coming through were based on the work coming from Sparked and FHIR. And that really is starting to move the dial on how fast we adopt Sparked work and outcomes. And I would imagine within 3 years, there probably won't be any new connection requests being processed in My Health Record using CDA. So what I would say is that migration to FHIR has well and truly begun. Unfortunately, at the moment today, we all log into My Health Record or into the system. You still see those CDA documents, but I can assure you the change is coming and it's very exciting. The other thing also to flag is Health Connect, which is Australia's National Health Information Exchange that we're building, and Daniel touched on it. Sorry, Daniel McCabe, there's too many Daniels and Peters today, touched on it earlier this morning in his presentation. Health Connect's being built on FHIR from the ground up. Some of you might be aware of Provider Connect Australia, which is a core foundation for the directory service in Health Connect. That's already FHIR enabled. We're already working on the roadmap now with the Department of Health, Disability and Ageing in terms of what are the next roadmaps for what comes in. So is it e-requesting, is there e-referrals? How does all that work from Sparked go through Health Connect? So the really exciting thing is the stuff we're discussing today during Spark symposiums, in all the clinical design groups and technical design groups and all those things, is being used on a daily basis as we plan the future for the digital health ecosystem in Australia. Apologies for the croaky voice. Lovely to be here, and I look forward to all the questions shortly. Thanks, Peter.
Thank you, Peter. I appreciate you providing that update with news updates, and it has inspired some good discussion in the chat that no doubt we will unpack in a little bit on the panel. So I'm going to pop you backstage and we'll rejoin you shortly. As we continue to move around and reflect on the role of Sparked in Australia in particular, speaking with partners, it would not be a Sparked FHIR HL7 style event if we did not have our next participant join me on stage. So David Rowlands, thank you so much for joining. Looking forward to hearing from you in this short session.
Thanks, Peter, and good morning, afternoon, evening, depending where you are, to everybody who's on board. Look, it really is a great pleasure to be involved in the Sparked program. I've been involved in standards development in health for far too long that I'm going to admit, but Sparked has actually demonstrated that standards development really can be fun as well as extremely successful. It's a great program. And having just returned from the HL7 International Working Group in Madrid that Daniel Vreeman spoke about earlier, I can assure you that Sparked is attracting a lot of international attention as well as being a force of nature here in Australia. So HL7 Australia and Sparked. Well, for anyone watching who is quite new to the standard space, HL7 Australia is HL7's international affiliate in the Australian domain. That formal affiliation gives us certain rights and responsibilities concerning HL7 protocol specifications within Australia. For example, HL7 Australia has the exclusive right to formally declare what implementation guides are considered to be part of the HL7 endorsed base or core fire implementation rules for Australia. So what does HL7 Australia bring to the Spark partnerships, and what are our priorities for the foreseeable future in relation to these? So Peter, can you move on to the next slide, please? Firstly, we provide a conduit to building the HL7 Australia fire core specification. Spark's engine room is its clinical design group, and it produces clinical data specifications. These are then channeled via HL7 Australia to become part of the Fire AU core. By handing these data specifications onto HL7 Australia for technical design, balloting and publishing, Spark takes advantage of very well long-established governance, infrastructure and processes for data exchange standards development. What we want in Australia is data exchange standards that are as international as possible, but meet our local requirements and fit our local contexts. And that is HL7 Australia's core business. Our priorities for the near term in relation to this role include expanding the Fire Core. Release 1 was published in January this year. Release 2 is scheduled for publication early next year. We'll be trying to raise awareness of the AU core amongst the implementer community, particularly those less experienced with HL7 and Fire. And we'll be looking for ways to support the implementation of and innovation from the AU core by making Fire community expertise more fluid and accessible. We will also publish release 1 of the AU e-requesting fire implementation guide and the AU patient summary. The latter is scheduled for mid-2026. Moving on to the second dot point, these HL7 and HL7 Australia brands mean something. They mean that the standards bearing them have been developed openly, that anyone can participate, transparently, that anyone can see how and why certain decisions were made, with balanced input so that no single participant or small group can dominate or hijack the process, and in ways that build trust and consensus, which in turn leads to reliability when implementing those standards. Now, with respect to trusted standards governance processes, the 4 partners in Sparked last year collectively established the Australian Fire Coordination Committee, or AFCC, that now manages the Australian fire community process. And that is the governance process via which consensus-based fire standards are produced that meet our stakeholders' needs. And HL7 Australia provides the Secretariat for the Coordination Committee. A set of implementation guides are about to pass through this Australian fire community process, with more expected in the near future. And we will work with our AFCC partners to ensure that the community process works well and that projects passing through it have all the support that they need. We will also be continuing to improve our standards development processes to make them as transparent and accessible and efficient and effective as possible. With the best will in the world, standards processes are very deliberate in order to guarantee that openness, transparency, balance of interests, consensus, etc. But that means they can be a bit arcane too. So we're in the processes of publishing our own Australian Governance and Operations Manual that describes our processes in detail, but hopefully will be a bit more understandable than some of the documentation we've produced in the past. We're also developing a series of short videos via Peter Birch and our good friends at Talking Health Tech, which explain important topics to make them as understandable as possible. And we will produce other informative material that enables newcomers to readily understand standards development processes and participate more easily. The third dot point, and several speakers already have mentioned this, we provide a diverse expert community that connects with international HL7 communities, meaning that we can readily source national and global expertise and find out how others are tackling similar issues. Our priorities with respect to the Australian fire community include attracting newcomers from some closely related sectors such as aged care, disability, social care and population health. But we're also surveying our current members to see how we can provide better service to them and strengthen the overall community. And we are reviewing our role with respect to education and training. We'll be working with the agency on validating the quality of training offerings, and we'll be looking at how we can increase the number of fire certified people in Australia. Over the last 2 years, with agency funding, we, along with the CSIRO and the University of Melbourne, trained about 1,000 people in the basics of fire. But there's so much more capability building to do and more implementation support that we can provide. Finally, the last dot point, we provide connectathons via which sparked stakeholders and others can test their products to ensure they actually work as expected when interfacing. And they can receive some mentoring in the process from some of the world's most experienced and expert practitioners. Sparked work, such as e-requesting, patient summary and so on, will continue to be a focus for our connectathons for the foreseeable future. But the last few connectathons have also featured a Smart on Fire stream where app developers can see how their products interface with others. I'm sure this will continue, and as new sharing by default priorities come along, we'll cater for these too. We also want to have a look and see how we can broaden the Connectathon program, providing information, training and mentoring services where the relevant experts are already gathered. We'll also try to look at taking Connectathons beyond Sydney, Brisbane and Melbourne and so on. I believe that Connectathons offer great value for time and money for the participants, and the question is, how can we make that value even greater? The final thing that I'll mention for now is that we are also systematically improving our own organisation as well as supporting the health sector's digital transformation. HL7 Australia has been around for about 27 years now, but has grown somewhat organically. And we're now reviewing everything we do, how we do it, to make sure that we are as sustainable, effective and productive as Australian healthcare needs us to be. So great to be part of the Sparked Partnership and Symposium, and looking forward to the panel. Thanks, Peter.
Thank you, David. It's great to have your perspectives, and we'll continue to hear reflections from our final Spark partner in a second, and we'll join you in a panel in a sec. Thank you so much. Stage is the one and only Brett Sutton from the CSIRO, fellow podcast host and other extraordinaire as well. Brett, thank you so much for joining us today.
Thanks, Peter. And I wish I had the podcast skills that you clearly have, but
there's still time. There's still time.
Excellent. Well, great to join you and all the other Peters and Daniels and Simons and Davids and anyone else who's got a Old Testament name. Brett was a name invented for children born between 1965 and 75, so you won't see many of us anymore. Great to, well, I'd say see everyone. I can't see anyone other than myself. Great to see me, but great to be here with everyone. And I'd like to talk about why CSIRO is invested in this. The top line is that we understand the enabling environment that data interoperability provides for everything that we're trying to achieve across the health sector, in healthcare in particular. And we know that the coordination of care and patient-centred care and following care along the life journey are really critical aspects that we need to make as efficient, effective, cost-effective as possible for the Australian patient and broader population. My particular bent, however, I'm a public health physician, is both to be an absolute champion of that enabling environment in digital interoperability, but to also push the envelope to whatever extent I can around what it can achieve in terms of impact, which means broadening the view to the biggest population level and to the lowest rung in the prevention ladder that is possible. In the world of public health, we talk about the prevention pyramid, and clinical care is at the top of it. Clinical care is that pointy bit where you can't avoid it. People have immediate and urgent and manifest clinical needs, and you need to treat them, and that care needs to be, as I say, safe, quality, effective, coordinated. But the population health view recognises that you can't hospital your way into full health when disease is already manifesting. It often has a very, very long latency period or incubation period before it becomes manifest and requires acute care interventions, hospital care or primary care, whatever the case may be. But also that the determinants that underlie the diseases that manifest in later life are complex and largely sit outside of health care or clinical care. 80% of health determinants are outside of clinical care. And so if you want to shift the dial and deliver, as we talk about, healthy and well years for people, you need those interventions to be at scale and to be at the right level, at the earliest possible intervention that you can. It becomes trickier in terms of the causal pathways that lead to disease because they are broad and they are, as I say, largely outside of the healthcare sector, and therefore the KPIs and the responsibilities and accountabilities at a departmental and ministerial and provider level become trickier to determine, but they are nonetheless really important. So what's the pyramid look like? Clinical care at the top, but then there's tertiary prevention. So tertiary prevention is like an early intervention. Secondary prevention is that even earlier, so stopping some of the disease progression that you see in disease pathways, and primary prevention, which is stopping that disease in the first place. And then we talked in public health more recently, not so recently, but maybe it's new to a lot of people, primordial prevention. So at that absolutely fundamental level of the social determinants you might have heard of, social determinants of health or broader determinants of health, which are socio-demographic, economic, environmental, etc. And so when we talk about the 20% that determines health in the clinical world, we're all very familiar with it. Pharmaceuticals, medtech, biotech interventions that make us healthy again or keep us healthy or try and mitigate disease outcomes. But there are a whole bunch of other interventions that, we're broadly familiar with. But if I can give an illustration, if I take rheumatic heart disease, so of course people with rheumatic heart disease need clinical care. They might need a valve replacement and then lifelong anticoagulant therapy. But what is the tertiary prevention? Well, it might be a balloon angioplasty, which stops a valve replacement being required, but it might also be prophylactic penicillin to stop that valve disease becoming worse. Secondary prevention, the throat swabs to stop the group A strep sore throat that leads to rheumatic heart disease. Primary prevention would be a vaccine if we had one for group A strep, and lots and lots of people are working on it because it's at that fundamental level where it would potentially stop all rheumatic heart fever. And then at the primordial level, it's dust, overcrowding, the behaviours that keep your face clean, and poverty is probably the biggest determinant of that as an outcome, and really so much disease that poverty is the primary determinant. And so I think there are real opportunities in data interoperability to push the envelope and think about the scope of those important data sets to connect and to interrogate and to link for a whole bunch of reasons. They might be informing the policy landscape for policymakers to have a clearer understanding of the things that are determining those disease pathways and disease outcomes that we're all invested in managing, but to think about it at that prevention level and maybe to have some clearer guidance and clearer understanding of the value proposition of intervening at that earliest possible time. There are some that we are working on much more clearly, but others that are largely neglected because of that fuzziness in the causal pathway. In diabetes, it's very clear. If you need a foot amputation, you get a foot amputation. But we know that an earlier detection of the vascular changes in feet, the temperature changes in feet can stop you requiring that amputation. And we're going even further, better glucose control. At a primary level, weight loss for type 2 diabetes can avoid it altogether. And then at the total ecosystem level, food systems. Now, I'm not pretending that Sparked is going to change the landscape of food systems in society, but it can work at a whole bunch of levels for a whole bunch of diseases in that prevention pyramid. We know that primary care data is an absolutely rich data ecosystem that we have not mobilised and connected to as much as we should, and that the data standards embedding and the data interoperability enabling culturally, technologically, legislatively needs further work. But it could be a really, really promising way to intervene at that, if not primordial, hopefully primordial level, but primary and secondary prevention level to really make a difference in delivering healthy years of life for all Australians. CSIRO has been working on Indigenous health check, which is very much in that space, very much in the primary and secondary prevention level. The kind of things that you check on in an Indigenous health check can stop disease starting in the very first place. But when I think about all of the opportunities that exist in that primary care encounter with your GP, it's innumerable. It's not just for a single disease, it's for a whole bunch of risk factors that can lead to a whole bunch of diseases. And being able to defer, avoid, completely eradicate the possibility of some of those diseases becoming manifest is a really promising avenue to explore. We don't have a proper young person's health check, but if we can embed that in the routine procedure and software that GPs had that draws on all of the information that's required to help fill out what that health check would look like, the HPV vaccination that young people would get, whether in school or a pharmacy or through another GP or through a school council, they're all super important. the BP and body mass index and skin checks and mental wellness and STI screenings that should be part and parcel of every young person's health check. They are really, really critical, and we need to create the enabling environment in a primary care setting that allows it to be a straightforward, almost automated, almost unconscious process for a GP, so they don't have to scroll through 12 different websites and 50 different screens and take their time away from being able to provide some guidance to that young person who might be sitting in front of them. I also think that there's a policy landscape that we can really deeply inform through the broader understanding of the factors at play in health. The Australian Institute of Health and Welfare, huge repository of really valuable data, a lot of which is healthcare related, obviously, healthcare separations and the like. That can be really informative, but it also links to ABS data, and it also has that richness of socio-demographic data that can be super informative about where we put our time and energy and focus. Now, I don't know if all of that is HL7 enabled, and maybe that's a conversation that David and I or others need to have with HL7 Australia and HL7 International about what should and could be captured in order to make the most of that data interoperability to drive wellness and to drive healthy years of life. Sometimes it's really invisible, the health outcomes, because we're not capturing the data or we're not able to capture it in near real time, that I think is sometimes an obstacle for policymakers, because it doesn't have the immediacy as things unfold. And when I think about, the tragedy in Victoria in the Black Saturday bushfires, nearly 200 people died from the direct effects of those bushfires in the same 4 days of extreme heat, and they were days of extreme heat. There was an estimated excess of 350 people who died. Now, that is equally tragic, but largely invisible, and people won't have been aware of that excess in deaths. If we can have real-time views of primary care presentations, prescriptions required, or other data that would inform us about the incredible hazards that were playing out in real time, a heat hazard playing out in real time, then we can have interventions from a policy level, but also from an emergency response, health response level that can be really informative. The same applies for poor air quality. When there are bushfires and PM 2.5 levels are huge and we need to wear masks and be inside and turn our filters on, we would do that with greater clarity in the same way, that none of us want to forget kids in hot cars. We would do it with the kind of immediacy and emergency response. If we understood that there was an excess of 10 or 20,000 primary care presentations or emergency department presentations that related to things that smoke cause, stroke, dead on arrival, dead at home, heart attack, asthma, and other respiratory diseases. I think there's so much opportunity here. So I'm both the super advocate, but envelope pusher at the same time. So I hope the ecosystem can bring that into consideration, because there's a real power in population and prevention health. Thanks so much.
Brett, I feel like that's provided such great rounding for, what the why almost, and in hearing from the different partners. Let's bring on all the partners that have just given their piece, and we'll wrap out this session of part 2 from the Spark Symposium. So we've got the representatives, and I feel like you look at the Sparks program particularly. There's something unique, something special, something different about it, because I'm not, I've been around in the healthcare space for a while, and many in the chat and here on the stage have been around for a lot longer. And the amount of time, the years that we've spent talking around, we need to have interoperability, and it becomes almost a throwaway term and loses a lot of meaning. But there's something different about Sparked. I feel like the presentations from each of you has has filled that out for me a little bit more. And in the context of looking at what's happening in the chat, there's live attendees that are clinicians that are asking questions and sharing and getting involved and participating. But I'd love to hear from each of you, because we've only got about 10 minutes in this quick panel wrap-up session, but perhaps from each of you for a couple of minutes on what is different about Sparked, and what is that Spark difference, because things have been achieved. I feel like it's okay for us to pat ourselves on the back for a little bit for the moment. I know we're all doers and there's a lot more to be achieved, but given we've got each of you here, because there's probably great lessons for others too, and will inspire more to be involved. Perhaps if we start back in the order of presenters, Simon, I'd love to hear from you on what is that Sparked difference and what makes this different to other interoperability initiatives?
Thanks, Peter. I think one thing is just how much work has gone into building consensus. And I don't just mean in the sort of way that we go about the process of balloting and agreeing to the standards, but even things that people probably don't appreciate, which is that we've got all the states and territories as founding members of this program, in addition to the Commonwealth Government, with all the different healthcare providers that are involved in this program, et cetera, et cetera. So we do actually have national consensus when it comes to the involvement of governments in a program like this. That should not be underestimated how powerful that is. And I know we've got some of the state and territory partners coming up to sort of talk a little bit about their own experience of Sparked in a little while. But I do want to thank all the states, because, there is a lot that goes on behind the scenes. Everybody's got a huge agenda, a huge program, and huge implementations. But to be really focused on the future and making sure that as we build out the future, we're considering the way that we move data around the system, that's a really big different thing to the traditional way that we think about how do we go about interoperating within a system that we might operate in. The second thing I think is having clinicians and technologists together in the room with consumers, actually really working through that consensus process. It was a very powerful panel at the Digital Health Festival in Melbourne a couple of weeks ago, with some clinicians and consumers on the stage talking about that process of gaining consensus, and that it's not just about agreeing on everything, actually the hard part of disagreeing with each other, but listening to each other's views and coming to the middle ground and being prepared to have your view challenged and having your view changed. I think that's also been different in Sparked. So they're probably the two things for me that stand out, and I think one of the two reasons why we've been so successful.
Yeah. They're great points, and gradually as we get through the panel, people like Brett, who'll speak last, will have less and less things. We'll have to think of new creative things to mention. But Peter, what about you? I'd love to hear your thoughts.
Yeah, and look, I won't do the me too from what Simon said, but the areas I'd say that are also different is timing. All the planets are aligning for actually whether the technology is ready for it, whether there's a societal drive and acceptance and consumer demand for this. Clinicians are engaged and actively wanting to get more information about their patients. That is, I've never seen the planets align like this to enable us to deliver truly connected care across the country. And I think that's one additional thing I'd emphasise. The second, I think, is we have a whole investment in all the national infrastructure, whether that's through the development of standards and the work for funding for Sparked, modernisation of My Health Record, Health Connect Australia, and a variety of other things that are happening. That's also coming together at the same time. A lot of the states and territories, through their acute hospital systems, are investing massively in bringing in digital systems. And I think those things are also quite different. And the third is the National Healthcare Interoperability Plan. And Simon touched on it earlier in his talk. I promise I won't go through it in detail, but what I would say is there's 44 actions in there for governments and others to do. A lot of that work is very unexciting. And I, of course, would be remiss if I didn't say standards are sexy. So there you go, Kate. I've got there now. But what I would say is a lot of that work around the how do we ensure that healthcare identifiers are just universal and used everywhere, every time? How do we ensure the legislation is harmonised? Those type of things are all an interoperability plan. We don't talk about them at Spark because we don't need to, but they do underpin all the work that's being done. So there's another couple of different things of why it's different this time.
Yeah, absolutely. I agree with you on the we're taking advantage of those planets aligning, as you say, but a lot of work needs to happen in order for it to eventuate. So, David, I'd love to hear any reflections from your side as well.
Yeah, a couple of things. I mean, I think one of the great differences or the great assets of the Sparked approach is the power of partnership. We've got the four formal Spark partners around the table: the department, the agency, CSIRO, and HL7 Australia. But there's also an enormous number of founding members of the Sparked program who are also partners in it. And what Sparked has done extremely well is take the time and make the investment in establishing relationships that make all of this work. That feeds into my second point, and that is about critical mass. What we have in the Sparked program, I mean, if you just go back to some of those statistics that Simon was talking about at the start, the amount of input into the Sparked program is phenomenal. Around standards tables, you normally get a much smaller set of people. But because, for example, there's so many more clinicians involved in this one, it is absolutely impossible to ignore the fact that what we're on about here is trying to make health better. We're not just trying to create technical standards. It's also impossible to ignore that the clinicians have to address some technical things. So simply that critical mass really, really enriches the debate and keeps us focused. And it was terrific to have Brett closing out the presentations, because that's exactly what I mean. This is all about what Brett was talking about, not the kind of arcane stuff under the bonnet that I spend a lot of time talking about.
Well, look, it all ties in, doesn't it? And but that's such a great point that and I certainly get the vibe, even looking at through the comments and questions that people are putting through in attending some of the Sparked sessions. There's everything is on the table, and whilst we may not get to every question live in this session here, generally at a Sparked event, every question will get answered. And if we don't have the answer, then let's work out who will. So there's a lot of people are putting that hard work into transparency there. Brett, I'd love to hear from you. Any other final thoughts and reflections?
Yeah, it's hard not to go over the old ground, but I think I would like to reinforce that Spark does what every proper co-design process should do, which is to create the enabling environment for all of the diverse inputs to come together, to have an open, frank, and appropriately contested space to come to the consensus that leads to the outcomes that we're all seeking. And that doesn't happen accidentally. That happens by deliberate thinking about what creates a welcoming environment, what creates the energy in the room, what makes people feel enabled to speak their mind, and what makes them feel valued in providing their inputs into the conversation. That's a kind of behind the scenes design process, but that's, I think, a huge part of the success of Sparked, that the creation of the community has been done very mindfully, and that the outcomes that arise from it kind of happen organically because that hard work behind the scenes has been done so very well.
Yeah, 100%. And look, that sentiment's definitely coming through in the chat from attendees live as well. We can see, some of those OG regulars and whatnot have definitely resonating with that as well. And Michael's also shared, it's really an opportunity for others. It's not too late to get involved, and it's always, something there for everyone. And this is the right community to do it. So it's been great in this session to really focus on, those key partners for Sparked and where those priorities are, what we've achieved and where to. We'll be moving on in session 2 to really look at what the jurisdictions are doing. But in order for us to do that, I'll have to say goodbye to our partners here. But thank you so much for your perspectives today.